Understanding the basis of Starlings Law, or why the heart pumps more when it is filled with more blood. So let's understand this. See, the heart receives the blood from the superior and inferior vena cava, that is the right atrium, from the pulmonary veins, that is the left atrium. So once it receives the blood, the initial length of the muscle fiber will be more stretched. When it is more stretched, it will contract more. So Starlings law states that the force of contraction is directly proportional to the initial length of the muscle fiber. This is what the law states. Now why this law is important? Because when the heart receives more blood, that is the end diastolic volume, the force of contraction will become more due to positive inotropic effect. The force of contraction, when it is more, the stroke volume will become more and the cardiac output also increases. So this helps the heart to pump whatever blood is accumulated in the heart during the diastolic period. So that is the importance of Starlings law. Now, to understand this law in detail, whenever the heart muscle stretches due to increased venous return, there is considerable degree of overlap between the actin and myosin. Imagine this myosin, this actin, there is overlap. There is something called sarcomere, the structural and functional unit of a cardiac muscle fiber. More the overlap, more will be the contraction. So that is the microscopic level what is happening in the Starlings law. So the length of the muscle fiber is the force of contraction is directly proportional to the length of the muscle fiber. The length of the muscle fiber is determined by the amount of blood which is present inside the heart, that is end diastolic volume. So due to positive inotropic effect, whenever we give digoxin, it causes increased stroke volume and cardiac output due to Starlings law. So when we give beta blocker reduces the heart rate, everybody knows that. But why does the beta blocker reduces the heart rate? Because of negative inotropic effect, it reduces the stroke volume or reduces the amount of ion inside the cardiac muscles, thereby the force of contraction, thereby the stroke volume. So therefore beta blocker reduces the cardiac output. It has got negative inotropic effect. Whereas digoxin on the other hand is given for heart failure patient because of positive inotropic effect. There is one limitation of Starlings law, that is the amount of the stretching of the cardiac muscle should be optimum. If it stretches too much, then it can result in cardiac